This is Chris Kelly with the third presentation in our Peak Trainer 1 series, Client Fitness and Movement Screening. Whereas our first two presentations looked at the basic habits and motivations of what we may see in a beginner client, as well as basic exercise selection, now we start to look at the individual themselves and how screening influences what we will do with the client. So number one, we want to understand the importance of screening and how it influences our program design. The reality is that everybody is going to be doing the same basic exercises, but by the same token, we want to understand what not to do. And movement screening helps us to look at the client and have as much information as possible going in so we can give them the best experience possible. We also want to look at the client's training status. All right, we are going to watch them exercise, and for a lot of clients, we might start them, down on the floor, whereas, with other clients, we might start their push-up up on a bar. So it helps us to understand a baseline for these basic exercises such as a push-up, a squat, and how we load them initially. All right. So we want to review our basic screens and how they they're implicated in program design. So why do we screen at all? Number one is we want to understand what could go wrong. As I said, everybody is going to start out for us with the same basic progressions, but by the same token, we have people much farther along on the continuum versus those that might have pain with something like a push-up or pain when they raise their arm over their head. We never want to do these things when a client is in pain. So if we can screen somebody in 5 to 10 minutes and understand those type of movements, we can refer them out for the proper treatment before that ever becomes an issue. We also want to identify basic disconnects to treatments or to exercise. We talked about this in our habits-based coaching presentation already, but by the same token, this screen sort of helps us to move this idea along. We also want to identify basic interests and goals and then determine the client's current injury status. So again, we're giving them the proper exercises and progressions for their level. I always use my client Caroline there on the right as an example. Caroline is an experienced runner. She's run many 5 and 10Ks, and she lost over 100 pounds doing so. She came to me about a year and a half ago in order to improve her 10K distance. She just felt like she was giving out at the end of races, and she was getting tired. Her muscles were just kind of fatiguing, from anywhere from the middle to the end of a race. So when we moved, she moved fairly well. She moved through squats and lunges and that sort of thing fine. But when we got her on her back and we kind of looked at her movements, we looked at her active straight leg raise, she had basically zero range of motion. And the problem with that is that because she didn't have the necessary range of motion to move through, everything that she was doing was muscularly inefficient. It took more effort to move through these ranges of motion, so when she got tired, she would fatigue earlier, she would lose her cadence when she was running. So simply by improving basic mobility, we were able to shave a lot of time off of her 10K time and really help to improve her performance by not ever picking up a weight. So that's definitely the other side of it. But as well, we kept her from being injured, and I think that's the most important thing, is that we understand injury potential initially, so going in, so when we move through these things, we can understand what not to do and when to refer out when necessary. So an overview of our assessments. Number one is that we want to take a thorough health history and a interest questionnaire. The number one cause or the number one determination of future injury is previous injury. So injury history is crucial. If your client has a low back problem, their low back is most likely to hurt during exercise, and we want to know that going in. Current pain status is the next important thing. We want to understand exactly what is hurting our client currently, if anything, in order to know what not to do. If your client has pain doing push-ups or any type of exercise, we want to stay away from those until we can refer them out, to the proper physical therapist or doctor, whatever it may be, and get that cleared. Pain obscures motor control, so we cannot expect a client to perform normally in the presence of pain. So we definitely want to address that before we move on to anything else with that particular movement. We also want to understand the client's personality and goals. The reality is that not everybody is going to be the same. Some people are going to be introverts that like to track their progress and work alone, whereas others are going to be extroverts who like to exercise in a group, who enjoy challenges, and whose fire is lit by working against other people. So this assessment is going to help us immediately tailor our approach to whether the client trains alone, in a group, and how we sort of create their program for them. From there, we're going to move on to our posture and health assessment. And for us, this is movement screening, where we look at big global movements such as overhead squats, split squats, and just watching the client move through daily patterns of life. And then from there, we identify, maybe if the person is leaning forward as they squat or they're laterally flexing as they lunge, we do more isolated testing on the upper and the lower body to get specific with stretches and mobility drills. Finally, when appropriate, we're going to do fitness testing. This is going to help us to determine a baseline for exercises such as the push-up, the squat, the deadlift, and it's also going to tell us about the client's work capacity. For us, if we do a short interval circuit and we see that the client gasses out after about 25 to 30 seconds, we know that 1, they're not aerobically fit, and 2, there might be some sort of a nutritional deficiency as well. What I really like about our assessment is that when we take our clients to this level of intensity, they sort of out themselves. The client might say, oh, well, I just didn't eat anything before I work out. I never do. And they'll identify these things that they might not have talked about otherwise. So I'm always making notes, and I'm always thinking about, what is the cause of this? What can I do to help this client to, be more successful? So we're always asking leading questions, and once again, sort of going through this idea of, questioning the client, kind of leading them through to get an idea of what we need to do and write down. Our assessment process is always going to begin by filling out a questionnaire with the client. We want to get to know the client, what motivates them, and any potential disconnects that may be keeping them from their goals before we exercise in order to get them excited about what is to come. So number 1, we want to understand what motivates the client, whether they're an introvert, who is better in a one-to-one coaching scenario versus an extrovert who might be, more of an alpha type personality. They like challenges, they're better in groups. Introverts are clients that have oftentimes either never exercised or been away from it for a very long time. This is a generalization, but I often see this with a lot of my female clients who will come in and make comments like, I passed by your studio 10 times before walking in. This is just walking in the door is a huge thing for them. So this person is going to require coaxing. They're going to require a very positive and motivating atmosphere, and they're going to be motivated by seeing physical progress. With this client, we're teaching them to log their exercises. We're teaching them to see tangible signs of their progress, and we're staying away from things where we're trying to challenge them and compare them to others. We don't want to do that. We want them to develop intrinsic motivation where they're doing it to perform against themselves and to see improvement from month to month. So this is somebody that is oftentimes a very good candidate to teach how to log their exercises, how to maybe execute a program in a small coaching group versus somebody in a fitness class atmosphere. Whereas your extroverted clients are people that are oftentimes already exercising or that are alpha type personalities who kind of own the room when they come in. These people are not necessarily the best candidates for coaching when we say, when we're trying to coach exercises or explain finite details, because they don't necessarily listen to you. That's not the way to get at this person. If you say chest up, shoulder blades down and back, I want you to look at the wall, they're doing bicep curls in the corner. They're not listening to you. So they're better mimicking others, and they're also motivated by challenges to others. So we warm them up in group atmospheres. We might have everybody do a squat. We might demonstrate the squat, just have everybody go around in a circle and do it. That's probably better for this individual because they're watching others. And then when we're working out, in a weight training or a conditioning scenario, we might write numbers down on the board and compare them to others, because for this person, they don't want to be the last man, so they respond better to challenges. Number 2 is that we wanted to determine any potential entry mechanisms that exist. Our client's lifestyle and what they're dealing with on a daily basis is going to be one of the primary determinants of their physical state. So if they lean forward the computer all day, the chances are they if they have back pain, it's probably flexion-based back pain that is due in some part to the fact that they're a computer jockey. Or if they have anxiety all the time, they're missing sessions, and they're in a stressful relationship, they might not be in a very good work situation. Life stressors take their toll. So we want to understand what we're up against, and as well, what hurts currently in the client's opinion. If the client says, oh, I have pain bending over, or when I raise my arm overhead I have pain, that's the best indicator of future injury right there, because the client is the best, knows their own body. So we want to write those things down and understand that before we ever have them touch a weight or start to exercise. The last part is that we have to sell the client on what we're doing. Okay, we want to immediately diffuse potential disconnects to why this program might not work. Okay, if the client hurt themselves squatting, then they're going to be afraid of squatting. Okay, and they're not going to want to do that with you if you have them train and do that in even an assessment situation. They'll think that you're not listening to them. So we want to write down and listen to the client, understand what they're dealing with, and then over time, in physical therapy, what happens is they do what is called graded exposures. It's not necessarily the squat that caused their injury. It was the fact that they did it wrong, the technique was bad, and it was just a culmination of things. So over time, we teach them to squat correctly, we teach them the hip hinge, and we start to reintroduce that exercise by setting goals with the client. But that's something that occurs over time. So the purpose of this questionnaire ultimately is to get the client's trust and to kind of sell them on the idea that we're there to help them and we're an expert and we understand what we're doing. So some potential disconnects that I see that can take us away take our clients away from being successful with you. Number one is schedule. Poor time management and the perception of just a long, boring session will kill any workout. And if you tell the client, this is exactly how we work, we're going to do 60 minutes every time, it's going to be one-to-one, and you try to lay everything out with minutia, that will work very, very well, probably for our introverted clients. But with extroverts, once again, they want a workout that changes often. They want a different experience every time. So understanding their personality type is going to give us a better idea of maybe how we put together the program. Number two is motivation. If the person comes to you in a post-rehab situation and their doctors tell them, well, you're never going to walk again, or your back is always going to hurt, they're going to have a grim view of what they do with you and exercise generally. So everything that we say to this person is going to matter, whether positive or negative, right? Oftentimes this person is going to lack support and they're going to lack discipline. This might be somebody that's never worked out in their life and just their whole life is set up against that. They go out with people that go to McDonald's every day. Their husband is not supportive or their wife is not supportive. And again, we have to think about how can we create a support structure in a positive environment that is going to allow this person to be successful. The other would be obviously finances, maybe avoidance fears where the person has been injured, and they're afraid of squatting or whatever exercise occurred. The goal is to figure it out. That's your job. We're kind of a detective in the beginning, and that's really the purpose of our assessment process, is to understand exactly how, not only what exercises are best for this person, but what strategies outside of fitness can I create to help this person be as successful as possible. So our health assessment outcomes. Number one is we want to understand current pain triggers. All right, anything that causes pain, okay, be it raising their arms over their head or bending down too far to pick something up. All of those things are indicators of injury potential. If the person hurts, we need to refer them out. If the person's back hurts when they touch their toes, do not deadlift with them. Do nothing that involves that motion. Simply refer them to a physical therapist and look like a superstar when you resolve their long-held pain. If you can do that, it's something that I often do. It's not a negative thing because we're authentically helping the person. Oftentimes insurance can pay for that, or people are happy to self-pay if we can address those factors. So rather than trying to deal with those things yourself, refer them out. It just makes you look better. Number two is movement screening. So we want to determine their competence in just these basic exercises that we've talked about: squatting, lunging, pushing, and pulling. And this sort of, after we've cleared the person from just a health history, this also helps us to understand, what might be triggering pain. If any of these things trigger pain, again, we can go through the same referral process. Or if we just see things that really don't look right, the person is maybe leading with their upper body, their shoulders are shrugging as they do the push-up, we can use our isolated testing to look for closer inspection. Really, isolated testing is just getting somebody on their back, raising their legs up, looking at how the external and internal rotation of their hips, something we'll talk a lot more about. This is just looking at their muscles in what we call a passive situation, where the client's not moving, we are. So we see if they're truly tight, or if there's some other stability or mobility issue going on. This ultimately is going to help us determine the appropriate stretches and strengthening drills, and it just gives us a baseline for all situations, from both corrective exercise as well as fitness, of where to begin. So with a questionnaire, what I'm always asking my clients is, talk to me about any prior injuries that would limit your training. This could be, hip injuries, things that happened to them as a kid, ankle injuries. The client is not going to volunteer this information. So if you leave it open-ended, if you simply say, tell me about things that you in your opinion would hurt you during training, they might identify something that's currently painful, but they're not going to delve into their past and talk about, oh, well, I broke my ankle as a 3-year-old. Those things are not relevant until they come up. So you have to bring it out in them through conversation. That's why I'm always talking to my clients during the assessment and trying to figure out, if something is off, what in this person's past might have caused that. So what I like to do is simply bullet point the big players in my assessment so we can get those things off the table. Number 2 is going to be the current level of activity. The client is working out, currently running and doing aerobic exercise, and we see this before they start working out or before we do our assessment. We have a pretty good idea of this person probably has a good baseline of fitness, and we might be able to move them along. This also tells us whether or not this person would adhere to off-day exercise. If the person is already doing a running club in their off days, they would have no problem adding some intervals to their off-day run or maybe doing something else. But if they're not doing anything at all, the strategy is going to be way different, and you're going to be fighting more of an uphill battle to get this person sort of buy into the idea that this is a long-term prospect and every day we want to be doing at least something. Number 3 is to identify any motions which currently cause or provoke pain. We talked about this already, but what I always do is obtain a doctor's release. Okay, so if the person has pain doing push-ups, we might have them refer them out, but we want to get them cleared by a doctor. If the person says to you, I have acute cardiac I've had cardiac arrest in the last 6 months, or I've recently had a heart attack, or just anything, any surgeries recently that might act as a red flag to you, always obtain a doctor's release. That's going to be really important, and that's going to cover your ass. That's the biggest thing, is that we do our due diligence, and that's not something that should take a long time if the person is serious. Last, and very importantly as well, is that we want to sign a PAR-Q and a waiver before training ever begins. If the person gets injured in your assessments, all right, that's on you. So have them sign this stuff before you do an assessment, before they touch the floor with their hands, anything. Okay, just make sure that they sign this stuff, so before we start to get into the physical side of it, once again, you're covered. Once we've gotten to know our client by filling out their questionnaire and getting them to sign the appropriate waivers, our next step is to look at what potentially could go wrong through movement screening. All right, and with movement screening, the idea is just to look at the client's body and to understand the risks for exercise before we ever start to throw them into these higher performance situations. This also plays into the idea that the primary mechanism of injury for most people in most situations where we're dealing with the hip, the low back, or whatever it may be, is going to be repetitive stress versus traumatic injury. Very seldom do we find somebody that is squatting in the gym and throws their back out, okay, or somebody that's hit by a car, and herniates a disc. These things happen, but these are one and done events. These are not things that are due to trauma that builds over time. But when we compare this to things like ACL, non-contact ACL injuries, or shoulder tendonitis, which are primarily due to overuse, we can see how somebody who throws their back out bending over to pick up a pencil has done this after they've bent over to pick up that pencil 1,000 times wrong, and then on rep 1001 they just go over that injury threshold. What I want all of our viewers to realize is that everyone exists on a continuum of injury. It's just whether or not we do things to push ourselves above or below this limit. With the majority of general population clients who might not be currently active, they might be dealing with a hip issue, a shoulder issue, or just something that is being masked by the fact that they're not working out and they're not pushing themselves over this limit. But when we start to introduce exercise and performance, where we're putting them into these higher threshold situations, then we start to go over this barrier. So we really need to look at what could go wrong first before we start to move on. The other issue that we want to look at is for asymmetries. You'll see in our movement screen that a lot of our tests are unilateral in nature, so we can look and compare side to side. And the second greatest indicator of potential injury after injury history is going to be asymmetry. So if we have more mobility on one side versus the other side, the body is going to torque when we're doing certain activities. So we want to identify this immediately as a red flag, and this is something that we look at prominently when we are screening. So movement screening overview, what are we going to look for? First and foremost, we want to understand the weak links, what could potentially go wrong. An example would be if I watch somebody do an overhead squat and their knees buckle together, I'm immediately thinking, okay, lower body, all right? This person might not be perfect in the upper body, but we can see where sort of the priority is going to lie. This also is going to correlate to functional movements. Some of these exercises, such as squats and our overhead squat, our inline lunge, and our single leg stance, are things that we see in sport. But a lot of these things as well correlate to activities that we also do in daily life. For example, a single leg stance, if somebody can't stand on one foot for 10 seconds, that's a very good indicator that we might have some issues with, running or gaits. And what we learned from this assessment is future injury potential. What could potentially go wrong, both in daily life and in sports, all right? And a key with this is that when we start to increase intensity of either exercise or activity, this becomes even more true. So movement screening is something that is very accurate for the general population, but it is extremely accurate for high-performance athletes who need to access the extremes of their mobility and the extremes of their performance. This is when this stuff really starts to become extremely more relevant. This also helps us to understand what not to do, what we don't place in the client's program. For example, if the client can't get their arms overhead, okay, on a shoulder flexion test, then I am not putting overhead pressing in their program. I'm going to work on improving the mobility of their upper back, and I'm going to do some things to address those areas before we start to look at this. Maybe I never overhead press this person, but the key is that I see this before it ever occurs so we can be safe and we can modify as needed. So some correlates. The overhead squat is a test that is very, very indicative of what we call early extension in the golf swing. This is a key test that we do with all of our golfers. And as you can see, we have somebody who is able to sit back on their heels, use their core to keep a flat back, as opposed to somebody that just doesn't have that hip mobility. Therefore, they have to find movement from somewhere else. So this guy has to round his back, and chances are, over the course of several swings, or several hundred swings, he's going to start to develop rotational low back pain or just issues extreme as well with performance. Another example would be our active straight leg raise. This is a correlate for deadlifting and hip hinging. So anytime that I bend over to pick something up, or I pick something up off the ground, such as a heavy weight, as we can see up top, then this becomes a relevant indicator. If we lack mobility here, then once again, I'm going to have to move from my back or somewhere else in order to find that. So if your client can't touch their toes and they're scoring ones in the active straight leg raise, we have a fairly good idea why. It may be a mobility issue, it may be a stability issue, we don't know. We just know that it's probably not the best idea to load this person up with a heavy deadlift on day one. So our movement screens, what are we looking at? We start with more integrated patterns. So before I ever get the person on the floor and start to look at, joint range of motion and different things like that, which we'll talk about, we simply watch the client squats. We watch them step through a single leg squat. We do an overhead lunge to watch them in a split stance, and we also do standing shoulder tests. So we do shoulder flexion, which is a correlate for overhead pressing, and then we do what is called a shoulder mobility test, which is more shoulder rotation. From there, we start to get them onto their back, and we look at their hip hinge pattern through the active straight leg raise, as well as core stability, both the posterior and anterior core through the plank and the glute bridge. And the way we score is through a rating and ranking system. If the person can do the movement perfectly, okay, they're getting a 3. If I see the person lift their leg and they clear my dowel rod in the active straight leg raise, they get a 3. I don't need to see it more than that because they did it well, all right? So I'm just going to score them a 3 and I'm going to move on. However, if the person can't do that, if there is some compensation, and maybe I make some correction or, I move it down or they're able to do it, but it just doesn't look right, then I'm giving them a 2, okay? They were able to do it, but it was with some compensation. Ones are reserved for people that can't do that at all right? And that will be very apparent Often it could be a mobility issue, it could be stability, but it doesn't really matter. You might make a certain modification that cleans one side up, but it doesn't clean the other side up. A 1 is going to be reserved for those that simply can't do it for some reason. And with that in mind, the priority with correctives, or when we're looking at how we can change certain things, is going to be placed on 1s and asymmetries. I only want you to focus on 1 or 2 things. We don't want to try to correct everything at once. That's not the point. The chances are, if we hit the right thing and we focus on the right focal point, then the entire screen will change. All right. So the focus is on 1s and asymmetries. So let's look at an example. Here we have John Doe. He scored very well in his overhead squat. His shoulder mobility and shoulder flexion were great, but on his active straight leg raise, we see that he has a 1 on his left side and a 2 on his right side. This is a classic example of a 1 with an asymmetry. All right, this is the root of all evil here. So this is what we want to focus on, and this would be my priority if I were doing corrective exercise with somebody. The idea is that we don't want it to be perfect. We simply want to get him to a 2 on each side. The goal for all of this stuff are symmetrical 2s. I don't want him to be 3 and everything. I don't believe that people are going to move perfectly. You know, we live our lives, and that's just how it is. You shouldn't expect to correct everything. But by the same token, we can establish a just standard baseline where everything is symmetrical. We have 2s in each test, and therefore we're able to move into normal training. Once I can get this person to 2s on each side, then I'm going to deadlift, and I'm going to move into more of a hip hinge pattern to cement that. That's another key, is that once the person is able to do the movement, and we change things through either doing mobility or stability drills, we want to immediately try to reinforce that through strength training and through using movement to move through that range of motion to tell the person that they need it. If we were to simply correct this through mobility or stretching or whatever it may be, and we see that the screen improves, but we don't do anything to cement that, it will quickly go back to its normal baseline, because the body wants to remain in its normal homeostasis. So we need to address that and really move through, immediately go from our corrective drills into strength training, such as a single leg deadlift or a deadlift in the case of a hip hinge pattern. So once we have our screening results, the question is, what happens next? And the first thing that we do or the first answer to that question is what we don't do. Each pattern correlates to a specific movement or specific activities that we want to look to either reduce or eliminate until we can bring that up to baseline. While the overhead squat first would be fundamental lower body mobility as well as a squatting pattern. So we want to stay away from heavy loading or high volumes of running. Right, if you have somebody that is a heavy squatter and they're a 1 on their overhead squat, we can even move to something like a box squat or a variation which we weren't required to use as much weight while we do corrective exercise. So I don't necessarily want you to think that we have to completely eliminate the movement, but we're not trying to go heavy with this or maximally challenge performance until we can increase this person's ability to hinge into this movement and execute it correctly. Our next 2 exercises are going to be single leg stance. All right, and these are heavy loaded movements in a split stance or gates. Okay, and once again, if this person is an endurance athlete, this correlates very well with running. So if this person is doing a high volume of running, or an endurance athlete, these are 2 activities we really want to look at and to help this person to manage them. My goal is not to tell someone to stop running, but it's to help them to manage their volume better, to be a better athlete. And that's the way that I'm going to put that. I'm not going to say you're never going to be able to run again, or you should stop doing it altogether, but I'm simply going to understand that before I say anything to them. That's going to give me an idea of, okay, how can I help this person to manage their schedule a little bit and cut out as much excess volume as possible. We can certainly start to put things back in, but this shows us that there's some degradation somewhere, so we need to address that. Shoulder flexion and mobility tell us about reaching overhead, so overhead activities. Oftentimes with clients that do a lot of overhead pressing, or maybe these are older clients who just have not really done much, maybe they sit at a computer for long hours and they can't get their arms all the way overhead, we don't want to overhead press simply because we can't get our arms all the way overhead. So for this individual, we're working on Horizontal movement, meaning we're doing things like push-ups, even bench presses where they're in a more of a horizontal orientation where they don't have to get their arms overhead, so they don't have to challenge their mobility in that way. What we're also trying to do is mobility work for their back and, again, their upper body. For the active straight leg raise, we're looking at the hip hinge pattern or bending over. All right, with this, we're looking at deadlifting as well as heavy squatting. So once again, this is somebody that's bending over to pick things up. These are hip dominant exercises, single leg deadlifts. We want to not necessarily cut out these activities, but we want to do things where we limit the mobility to their useful range of motion. And a great example of that would be a rack pull. If this person is currently deadlifting from the floor, maybe we elevate the deadlift on several, or we elevate the bar on several plates, so this person can then bend over and hinge with their back flat in their available range of motion. With the plank and the glute bridge, we're looking at anterior and posterior core stability. And once again, this is going to be heavy core loading for things like squats, deadlifts, and everything else. We've all seen someone that is doing back squats, all right, and arches their back excessively as they're going down, or rounds, all right? And this is just the result of oftentimes of a lack of core stability. So by limiting these activities or performing exercises maybe where instead of back squatting we have the client doing a deadlifting variation or something that doesn't involve heavy core loading, we can sub an exercise or work on technique while we're bringing these things up. Again, this just gives us a blueprint to understand what we do and what we don't do and potential modifications that we could make. So that's really how this is going to influence my program design. After understanding how our movement screen affects the exercise that we're going to perform with our client, we want to dig a little bit deeper. And what I mean by this is that when we look at a client squat, for example, and we see the knees buckle in, okay, or we have their arms overhead, they're squatting down and they lean forward excessively, we can identify whether the upper or the lower body is going to be the point of failure. If both are poor, then we're going to look at both areas. But what we want to do with this is just break these muscles out into a little bit more detail and look at them. And what I mean by this is just this isolated testing. We're going to have the client lie on their back and perform active movements. And there's a lot of controversy whether or not trainers and strength coaches are able to touch their clients. And for me, all I ask the client to do is perform active movements. Rather than touching the person, moving their muscles around, this is fine for some populations, but the person has to really trust you. So if that is an issue, all we would ask the client to do is simply lie on their back, for example, raise their left leg up, raise their right leg up, pull their knee to their chest themselves so we can observe movement. And then at the end range, you might give it a little tap to just get that in range feel. But in either case, we're looking at whether or not motion is going to be restricted when we take gravity out of the equation, where they're either on their back or on their stomach, and we're able to look at this in a little bit more detail. In order to perform our muscle breakout series, after performing our movements in standing, we simply ask the client to lie on their back where we can test lower body motions. Generally, we can, again, have the client move, we can move them through passive ranges of motion, meaning you're moving the leg to kind of, again, get that feel through the range of motion, and then ask the client to perform it actively to see how that compares. If we have a discrepancy between passive movement, meaning I'm moving the leg up and down, and active movement where the client is moving the leg up and down, we might have a stability issue, whereas if both are restricted, it's likely more of a mobility issue. This is something that we'll get a lot more into as we get further into our presentations and discussions, but it's a differentiation that I'm trying to make when I'm doing this. I'll make a note, I'll kind of write a note to myself, and that's the biggest thing with these things. This is very, very subjective. Unless you're measuring with a goniometer, then this is something that just requires practice, and something that I recommend that you do with friends and family over, I'd say, up to 20 times before you start to do this with your clients. If you don't know what you're doing with this breakout series or testing muscles passively, you're not going to look very good. So you need to understand exactly what you're looking for and how you incorporate this. And again, this is more of a this is an optional thing. I'll do this with some clients, but I don't do this unless I have to. If I don't see any reason to, if there's no restriction in the lower body, this is not something that I'm doing mandatory. But this is these are the areas that I look at primarily when I'm testing upper and lower body, and kind of that give me a bigger picture into what might be tight, what might be weak, and what might lack stability in certain areas. So now, once we've gone through our movement testing, we're going to move into normal training. And what I like to do with clients that are starting out is I structure it as a training session. We'll do their movement screen as their warm-up, and then their fitness testing is going to be their workouts. And all that is simply setting up a circuit of 4 exercises that act kind of as an idea of where we start as a baseline. I'm going to have the client, I'm always going to have the client perform a push-up because that represents fundamental pushing. Okay, the same cues for a push-up apply to a bench press, overhead presses, and this allows us to get a snapshot of how the client utilizes their upper body in a training situation. By the same token, an inverted row is the opposite. All right, it's a horizontal pull. It's the polar opposite. It's fundamental pulling mechanics. So again, we can see how they use their shoulders, and we can see how this would apply to, you know, a row, a chin up, and things that are a little bit more advanced. I'm going to look at a deadlift, all right? And I'm not saying I'm going to have them straight bar deadlifting from the floor. We could have them picking up a med ball that's elevated on plates, but I want to see how they hinge from their hips, whether they can do that at all, and if they've never done it before, how easily they're going to be taught. Generally with this, I'll demonstrate the exercise. I'll give the client a few cues. I might watch them perform a few reps and then, you know, throw them a correction or two. But once again, I want to see how they're able to do it on their own before I start to really get into a lot of teaching and different things. So the questions are, you know, what is the starting level for this client? Can they do this thing at all? Have they ever done this exercise at all? And then again, how do they take direction? Our last fundamental movement, which is not necessarily mentioned in much of our presentation, would be the split squat, okay, which I also consider to be a fundamental movement pattern. I think the split squat is very important because it represents sort of the single leg pattern and our progression from a split stance ultimately into things like single leg squats. So I want to see, you know, look at each hip independently, you know, whether the client folds forward on one side versus the other. So again, I just set this up as a circuit. I have them perform it back to back. Generally, I'll go upper, lower versus push-up, inverted row, but that's how it works. I ask the client to perform 10 reps and simply watch them move. You know, and I'm either going to progress or regress this circuit, you know, based upon how they perform. The good thing about this is if these exercises are very easy to the client and we go through 3 rounds and it's cake to them, then I know that I can start this person out at a pretty high level. But if they're covered in sweat and these are the things that are really making them tired and it just seems like they're, you know, they're gashed from these simple body weight exercises or very low resistance exercises for our testing, then I know that this is where we start the person. We only want to do as much as necessary, okay, nothing more. So this gives me a great idea of where I start the person and the progression and how they begin. Finally, we look at endurance testing, all right, and this is something that I only do with clients, you know, if they make it through the strength testing, if everything tests out well, if they're not in pain. If they're good to go, if they're in a normal training scenario, then we're going to utilize this as conditioning. And what I like to do is I use a modified Cooper's test. What we ask the client to do is perform 4 exercises back to back for a period of 8 minutes. The idea is you perform 8 reps for each exercise and you try to get as many rounds of that circuit in as possible in a period of 6 minutes. The way I explain it is if you're able to get 3 rounds in week 1, that's your baseline. If you can get 6 rounds in week 3, you've gotten in much better shape because you've doubled your work capacity. All right, so that's the idea. And what this allows us to do is see how a client reacts in a state of fatigue, okay, at these higher heart rates. Does the client gas out within 20 seconds, or are they able to do the circuit pretty easily? Okay, does the client feel nauseous? This is another thing, and this relates to whether or not they ate before they came. This might shed some light on some nutritional issues that we may need to deal with. And again, the client often outs themselves in this scenario. The other thing is this client willing to work hard for you or not? What I really like about this is, you know, it shows us which clients have a high work capacity versus those that might have never done something like this before. Okay, so is the client stopping to make excuses and getting water, or are they pushing through and really trying to knock this out of the park? This will definitely influence what we give the client as work in the beginning, you know, whether we need to work them up to this or if they're prepared to just go and push the gas pedal down. So again, all of these things beyond the fitness portion are just subjective indicators of the person's personality and how we can best structure the workout for them. So practical outcomes. All right, what do we do with this information? Number one, without getting into detailed explanations of correctives and everything else, which we'll later do, we institute a foam rolling and stretching program before the workout. Whatever you're going to do, do it first. If you need to perform corrective exercise, ask the client to get there 5 to 10 minutes early, perform a foam rolling routine along with their basic correctives. Just explain it as it's prep for workout. It's going to help you to perform better, make it relevant to the discussion. What I also like to do is insert corrective exercise into our warm-up and into our workout as active rest. So the person might perform a push-up followed by a deadlift, and then if it's somebody that failed their shoulder flexion test, we might have them doing an exercise like a wall slide against a wall, or if there was inflexibility in their lower body, we might have them doing a Spider-Man or whatever correlates to that inflexibility. Another suggestion that I would make is substitute bilateral and heavy loading based upon risk factors. Unilateral exercises are great because we don't need nearly the load to load them up, and as well as eliminating these asymmetries from side to side. So for a client that lacks mobility, maybe has stability issues in the beginning, we're doing things like split squats. One-arm rows are great. I like split stance row with on a cable system, and just extra single leg deadlifts, exercises that help us to address each side independently and teach movement. And then as well, we're going to test and retest accordingly. We're going to look at, the question is, are our correctives effective? And as we go along, we can use the same test that was their weak link, that they were scoring ones on, to set a baseline as to whether or not they improved. So some conclusions from our assessment. What are we trying to get at in total? Number one, we're looking at personality type. What interests this person, what motivates them, and what could potentially disconnect them from what they're trying to do. Once we've gotten this information, now we want to look at injury potential as well as what to remove in order to be successful with their workouts. As sort of a third concern, we're also going to look at just some basic stretches and correctives that we can insert into their workout, and then we look at their fitness and get an idea of where to start and what environment this person would be best in. If they're an introverted individual, perhaps teaching them to read an individualized program and to work in a one-to-one or a small group scenario would be better. Larger fitness class might be better for your extrovert. But again, after you've spent this amount of time with this individual, and my assessments last anywhere from 45 to 60 minutes, in reality, I'm going to take as long as I need with the person to ensure they're successful. That only makes me look great. And again, it allows us to understand what is relevant versus not. So my final conclusion with this is only test what is relevant to the program. Don't waste time with anything that doesn't have a purpose. And it's the same thing for the workout. Every exercise should have a purpose. There's a reason for everything. So, practices on people that you work around or that you train currently, practices with your friends and family so you understand what you're doing before you use this on other people. And that's the biggest thing. If you're already experienced in movement screening, practice new assessments and gradually move them into your rotation so you know what to look for, you know what not to look for, and you know how they become relevant to your